I was in a really bad place. My father had died. I'd been diagnosed with diabetes 2 days after my dad had died. I just felt, well, what else is going to happen to me? And I was just in total shock. Before the self-management, I was really badly depressed. I wasn't sleeping, and I went along, saw the GP. She said, yeah, we have a counsellor, maybe you could come along to see her. But there was quite a long wait. She said to me, well, there is another thing. She said, it's a group thing. She said, maybe you might be better off going to that. And I was really nervous because I thought to myself, oh my God, like, I've never really come to anything like this before. I wonder what it's going to be like. I don't know why I felt that way, because when I walked in, it's like I was embraced.
The whole idea of the course is to help patients to develop their knowledge, their confidence and their skills to be able to self-manage. So it's very much about people finding their own resources within themselves as much as possible to kind of take charge.
I felt as if there's somebody that understands what it's like, like to have something going on over a long period of time, because they themselves have got health issues. So I could relate to them and they could relate to me, as everybody else in the room was the same. I think it did change my life. I've been empowered. It sort of woke something up in my brain that only I can put across what is wrong with me. Every week that I went along, we spoke about all different aspects of our conditions, and one of mine really is I have really poor sleep. And while I was talking, like, other people were saying, well, yeah, this is the same things happened to me. Maybe you could try this, maybe you could try that. So by talking to other people, like, you get other techniques that you can maybe use, something that they've used and it's worked for them, so it might possibly work for you as well. Different skills, breathing exercises, meditation, action planning, speaking to healthcare professionals. There's a lot of different little things,
Patients are all on their own individual journeys because living with a health condition is so personal. Once they've hopefully built up their confidence and knowledge and skills on the courses, there's all sorts of different opportunities open to them. They might be having different kinds of conversations with their family and friends. They might be becoming more social. They might be having better relationship with their healthcare professionals.
If you're watching me talking, I would say to you, don't be nervous, because I think everybody that's walked through them doors have been nervous at one point or other, but it's a good thing. You all have one thing in common. You've all got something wrong. You've all took that one step to walk through that door. You may meet somebody else that has got what you've got, and they might be able to talk to you in a way that would help you, and maybe you could help that person.